welcome to Sunday Sessions, Dr. Lhamo Yangchen Sherpa.
Yeah, thank you.
To begin with, I'm going to read out your introduction so that our audience knows who we are in conversation with today. So Dr. Lhamo Yangchen Sherpa is a medical doctor, and she holds a degree in PhD in epidemiology from the University of Oslo, Norway, 2014. She brings extensive experience working nationally and internationally as a clinician, researcher, trainer, project manager, and health specialist with various organizations such as University of Oslo, Norway, Norhead Project, KOICA, Lancet, Melbourne University, and other INGOs. Dr. Lhamo also provides mentoring support to students studying BPH, MPhil, and PhD that come mainly from Myanmar, Tibet, and Nepal. She is also a reviewer of international journals such as the British Medical Journal, BMC Public Health, High Altitude Medicine, and Biology. She's also a contributor to various newspapers and magazines such as Nepal Magazine, Republica, the Kathmandu Post, Kantipur, Setapati, and Himalayan Times, published in Nepal, and a contributor to Voice of America. Dr. Sherpa is also a strong, vocal, and passionate women's rights activist. And that's her introduction. So welcome to our show today.
Thank you.
So to begin with, I felt like it was very important to start with the context because of your work background. Can we begin by talking about the difference between public health and epidemiology, because these are some of your areas of expertise, right? And I feel like for the benefit of our audience, a lot of people have confusions as to what these terms represent and what they mean and what they entail. So would you like to talk to me about that to begin with?
Yeah, actually, public health is quite broad. I mean, it's quite a general term, whereas epidemiologists, they are more into outbreak investigation. It has more to do with data and statistics. So that's actually the difference between public health and epidemiology, actually.
And you've done extensive work in both these areas because currently you're working as a public health official,
Yes.
right? But you've also done a lot of research work. So for you as somebody who's involved in both these areas, like how do they complement or how are they different for you?
When you look at, in public health domain, you have qualitative surveys and quantitative surveys, whereas in epidemiology, it mainly has to do with data and with numbers, which is different from the qualitative part. We don't actually do the qualitative part in epidemiology. So it's a little bit different, but at the same time, it complements each other because numbers don't tell you much about the actual story of those people. The lived experiences are not captured by the numbers. So the qualitative part complements it by providing insights or in-depth stories about the lived experiences. So that's why it's important. I mean, public health is important, qualitative is important, and quantitative is also important. So in that respect.
So are they complementary to each other then? For
Yes.
somebody who's a lay person and who's trying to understand these concepts?
Yes, actually on the day before I had a lecture with some, not lecture actually, I was talking to some students from Tribhuvan University who were social scientists. So that's where I said that we have the numbers, we have the data, but now we want the lived experiences of those people. Who are those people who are dying? Who are these people who are getting infected? That doesn't come from just the numbers. Numbers don't tell you the entire story. It tells you the prevalence, it tells you the probability, but it doesn't tell you that kind of stories. So it's very important. That's why to identify so that we can have effort, in those areas among those people who are affected by COVID-19. So that's why it's very important to have, information of both qualitative and quantitative surveys.
As of now, how are we faring in terms of some of the public health policies the government has in place? Because as far as I understand, every government has a public health policy in place, right? That's supposed to sort of come into operation, especially at times like these, at times of emergencies, so that it can take care of its people. How, as somebody who's working in this sector, do you view what is happening on the ground right now? Because I'm aware that you've also been traveling a lot and writing about these problems.
I think that we have a very weak public health system. That's why we are struggling with the numbers to bring even the numbers of those infected people. And we're also struggling to, identify the contacts of those people from these index cases, So I think we are quite weak in public health system, but in terms of hospital management, I think we're doing okay because we have a good public, a private sector as well, complementing, but then you have to pay. Right, so that's the difficult part, that you have to pay. So otherwise, I think we're doing okay, but not very satisfactory to to decrease COVID in this country. But yeah, so there's nothing more.
So it's not like a very pretty picture right now from your perspective.
Yes.
So
Yeah.
you've written extensively about health issues in Nepal, and you've traveled so much. And like every time I look you up, there's so much more to read, and it's so impressive. And I keep wondering, like, how do you really balance all this work you're doing with your other life, which is your personal life, right? I've always found that quite impressive and intriguing. Would you like to tell us something about, like, how do you balance this really busy professional life and your personal life?
Actually, my personal life actually includes a lot of reading. Actually, I don't have a personal life as such where I go and party and then have my time out. I mean, I don't have that kind of life. So that's why, I'm mostly into reading articles and journals. And it has been there ever since I was growing up. Even at school, I was always reading all the time. So I think it has been a part of my private life as well. So I think that's the difference. And there's no clear distinction between my private personally, this is totally a private life and this is a personal life. I'm reading all the time. So, I enjoy reading a lot. So yeah, especially articles, journals, whatever, I read all. I don't have a specific, I don't have any specifics. So I read everything that I can get my hands on. So yeah.
We usually ask our guest speakers to also sort of recommend a list of books to read. So yeah, I was just thinking maybe toward the end of the conversation, you might want to recommend a list of books that you would recommend.
Yeah, I don't like to read heavy books. I mean, there are some books which are too heavy for me. I mean, I don't like to read too much heavy stuff. But yeah, light stuff, that's both funny and it's interesting at the same time. And it gives you some sort of ideas about how to move ahead. I like that kind of books. Yeah.
May I ask you what you're reading at the moment?
I was reading, I think a book by Nivedita Menon. She's an Indian writer, and it's called How Feminists Think. Yeah, so I think it's a very good book. She's written a very good book, and I would recommend that women in this country and both men in this country should read that book. It'll give you a lot of ideas about how people think and what actually is a feminist and not a feminist, because feminist has been tagged with a negative, it has a negative connotation, but it's not it's not actually like that. So she's a good writer, and she's written that book. And my teacher, who happens to be in Nepal right now, she was teaching at the University of Oslo, so she gave me that book, and so it's really good. Yeah.
So looking at the work you've done, Dr. Sherpa, you're writing, you've written a lot of research papers, but also opinion pieces, but you've also had this life where people look up to you as an activist. You've done a lot of activism in the last couple of years that's really put you in the limelight and put your work in the limelight in Nepal, especially if we look at Twitter. Like even just to look at your Twitter feed, like Pranam was saying the other day, it's like the tweets you've curated and whatever you retweet, they make a really interesting read. And also you always seem to have these witty things to say, right? So in that context, I was thinking, I'm sure there have been incidents when you've been trolled or when you've had unpleasant things being hurled at you on Twitter. How do you deal with that?
Well, actually, to be very honest with you, I don't know how I became an activist, to be very honest. I mean, I started this as something to help other people. It's not like I want to become an activist one day, so I'll start tweeting or I'll start writing about this. I never had this, I never imagined that I would be called an activist ever. So I started writing about people because I thought that it might help others to think in a different manner. So that was my pure objective or intention, whatever you call. And that's why I started writing. And it has nothing to do with me trying to become an activist or trying to become somebody, because I remember when I was writing about Nirmala Panta, I was asked by Radio Nepal whether I had political ambition. And I was like, no way. No, that's not the reason why we're doing this work. We don't have political ambition. That's because we thought that it might help others to understand the issues, that probably do not get on the front pages of newspapers. And those are important issues. So that's the only reason. And yeah, there are trolls sometimes. I just mute them. I just mute them for some time, but I do unmute them after some time as well. So that's how I deal with them. That's how I deal with the trolls, actually. Yeah.
So did you come to feminism very early in life? What were some of your early experiences or influences growing up that
I don't even
led you toward this?
I don't even think that I'm a feminist, to be very honest. I think I don't know what I mean. When people say that, are you a feminist or are you, I mean, I don't know what it means actually. It's been very different from those different eras. It's been very different for different people. So I would say that, I've seen when I was working at the hospital in 2007-8, there were a couple of incidents that led me to, think that maybe it's important for us to focus more on women's issues. There was one incident that I recall very, very much and quite often, when this guy came to me with several reports. The woman was not having a baby. So they came to me and I said that I'm not a gynecologist. You should go and see a gynecologist, So he said that he's been to Prateebha, all those doctors, done semen analysis and ultrasound of women and everything, all the tests. And I said, okay, it was when BNB Hospital had recently started test tube baby, So I said, maybe you should go and talk to some doctors at BNB Hospital. Maybe they might be able to help you. And he asked me the cost. I said, I read in one of the papers that it was around 300 to 400,000 rupees. And, he just said that I can get a new wife for 50,000 rupees in front of his,
wow,
in front of his wife, And
wow.
I didn't know what to say to him, So then I realized, is this how, women in Nepal, should be living their life? Is this the status of women in Nepal? So that's when I started thinking, and that's when I started to observe the differences even more. So, there were several other incidents as well. So, yeah.
Yeah, I do think that feminism, the term itself, has become a term that's difficult to sort of untangle for a lot of people because of the different associations it has gained, I think, over the years. But I do believe that if one believes in the equality of different genders, then I do believe that you're a feminist, right? And I think there is this fear of being associated with the term for a lot of people because a lot of people also misinterpret it as feminists being people who are men haters, which is not true, of course, but it seems to have taken on that connotation because of different elements that have gone along the way. But again, I think that sort of ties it down to, like brings it back to the idea of justice. So because you're somebody who has been so deeply involved in the idea of justice, I was just wondering, like, what did the term justice made you think of as a child? Like when you thought of the term justice, what were your thoughts on it as a child?
As a child, I thought that it was doing the right thing for the, right thing. That's the only thing I knew as a child. I thought that because I've always spoken the truth, nothing but the truth. And I always thought that we should do the right thing. And that's what my parents had always taught me. And that's how my siblings had taught me as well. So I thought they're doing the right thing. And you have this, I mean, it doesn't really have to be influenced by your family members or your peers or even your brothers, it's just the gut feeling that you have. I feel that there's a gut feeling and you feel that, okay, this is the right thing. And when you are working in like, for instance, like international organizations, people will tell you, okay, you are not allowed to talk like this in front of the government. You're not allowed to say like this in front of the government. But then you have this deep feeling inside, the gut feeling that, no, this is not right. This is how you should be talking, So I think there's a gut feeling that tells you, and that is justice for me. So it's always been like that. I've never followed anybody's advice. I'm sorry, I'm being very honest. I don't follow anybody's advice unless I feel and really have this gut feeling that this is right. Yeah.
So it's the gut feeling.
Yes.
For Dr. Sherpa as well, apart from the child who also felt similarly.
Yes.
Oh, okay. Yeah. So I was also thinking in terms of like, I was reading this paper you did. It's actually a report that you worked on, which looks at the perception girls and women in different parts of Nepal have toward menstruation. And I felt like that was such an interesting way of decoding how problematic our reproductive health system is because of the way menses is being viewed, right, in the country. So I'm just wondering, like, would you like to share some of the experiences you had, like firsthand experiences in terms of who you met or how easy or difficult it was to talk to the girls that you were talking to when you were writing this report, because you traveled extensively across Nepal to write this report. And like even something as simple as something that would seem simple for somebody who was born and bred in Kathmandu, like buying a sanitary napkin, right, is something that is really a difficult thing to do for somebody who's born elsewhere in Nepal. So I'm just wondering if you'd like to share some of your experiences along that.
Yeah, I was the project lead actually for this menstrual health project, and I was the principal investigator. We developed this concept, we developed the question, and we also hired researchers and some field researchers to do this work. I actually, to be very honest, I did not travel extensively, but I gave them ideas of what sort of question you should be asking. What are the, all those questions were designed by us. The concept was designed by us, but then the field, the researchers, we had hired 4 researchers. One was, yeah, so we had 4 researchers and then we had field researchers. So all these people, they were instrumental in collecting data from the field. And then we analyzed and came up with the solution to do something. Until this research came up, nobody had, a lot of people had not linked menstruation with religion. Actually, they were all a lot of papers saying that this is a social issue. But then when you go, when you dig down, it all comes to religion. So if you read the report, you will see that we've also put in the all these concepts, that's coming from religion as well. So it was quite difficult to convince people when I was introducing this project, because you have to get approved from Singadarwar. I really had a very difficult time convincing the people in Singadarwar who would approve this project, because there were only 2 women and a lot of men at Singadarwar who said that I should not do this research, because it is negative, the first thing, and it doesn't show how the government is working towards improving the life of women. And I said, if the government is working so much to improve the lives of women, then why are women dying? You know, so there was a lot of back and forth. Finally, they approved this research, but it was very difficult, very, very difficult. They actually almost disapproved the entire project. So that's how difficult it is to work in Nepal.
Okay. I think I'm just struggling with my connection a little bit. I sort of lost the whole conversation there. But I think you talked about how it wasn't an easy journey, even for the researchers who are working directly out there.
Yes.
Yes,
because we were not just trying to find what was the issue, what was the problem. We all know the problem, but then you have to dig down into the problem and you have to try to find solutions from the field itself. You cannot have a solution built up in Kathmandu and then implement it in the field. It's not going to work. It's not sustainable. We've already seen that from the previous experiences, that it's not going to work. So we were trying to find a solution, but then, the government was like, okay, you have to highlight what we've done until now, and it's not there. So, it was quite, it was a difficult experience, yeah.
So I was saying maybe you could share something about the different interesting projects that you're working on at the moment.
Yeah, I'm working on safe abortion project, where we're trying to raise the voices of marginalized communities, for their right, and not only about abortion, about family planning, and some other reproductive health issues as well, and right in general. And the other one is I'm working on a project where I'm introducing a new family planning method in Nepal, which is called Sayana Press, and I'm leading the research. Other than that, I'm trying to help student from KU to develop her PhD proposal for the coming year, I guess, at one of the university in North. And other than that, I do edit some of the papers from high altitude medicine and biology and some others that come along. So that's all I'm doing right now. Yeah.
What about in terms of also, because you also crunching data, right, to feed into the system so that you can improve the public health system. How does that work in a country like ours?
Earlier, when I was working with Population Services International, I was the RME head and for research and some other projects. So what we used to do is we used to work, we used to collect data privately, and we had our own DHIS2 system. It was quite good. It was quite functional, and we were collecting data even using mobile app. We had introduced that in Nepal. But if you look at the government system, there are several gaps right now, especially after federalization. I think that there is a data gap. So what we, since we work closely with the public health professionals and public sector, we try to support them in order to ensure that all the data are collected and they are incorporated in the system. So that's what we are doing, in terms of data, working with the government right now. Yeah.
Okay. How many languages do you speak?
I speak I speak Sherpa, I speak Tibetan, I speak English, I speak Nepali, I speak Hindi, Urdu, and maybe a little bit of, I used to speak a little bit of Russian as well. So 7.
Wow, that's a lot of languages. That's amazing. Do you write in all of these languages as well?
No, not in all. Yeah, maybe just a few. Yeah.
How many of these languages do you also write in?
At least 5, I think.
5, and which others 5 languages?
I can write in Russian, Nepali, English, Tibetan, and Hindi.
Okay, and do you also dream in any of these languages?
No, no. But like I like the scripts, the Egyptian and the I think it's Ethiopian. They have these characters. I like those characters. Yeah, yeah.
I'm just wondering, what are some of the experiences of working with the government, because you work right?
The experience of working with the government sector is there are too many voices. I think the interim guideline has been a collaborative effort from everyone, including the government sector. The only thing that I feel is lacking is it's very slow. The process is too slow. It's been like 2 months, and the interim guideline just came out. If they had introduced this interim guideline within a week, within 10 days of this lockdown, a lot of lives could have been saved. But then it's been 70 days, and now we just have this interim guideline. So it's too slow. I think the process is very slow, and that's what is very disappointing when we're working with the government.
Yeah, we don't know when, but yeah, I think the least we can do is to be hopeful, right?
Yes.
You said process, so that also sort of made me think about the process of writing that goes into writing different genres. You're somebody who's done a lot of research-based writing, but you also write opinion pieces, and I suppose maybe you would also write fiction at some point in the future. So just wondering what goes into the process of writing these different forms of writing for you.
I have written from, I wouldn't say that I'm very, I don't write about party politics, I think I link social issues with political issues. There are social issues and there are political issues, and there are mandates for the politicians as well. So I try to link them both, and then I write what is in the evidence, what they have committed, what is in the government system. So I try to bring that issue. I think that's the only way, that's the only thing I write. And yeah, I've written from foreign policy to health to other issues, indigenous issues, and then marginalized issues to health access. So it's been very different. So I don't just focus on health, although some of my friends have said that maybe you should only write on health. And I said, no, I don't want to write only on health. I want to write on different issues, and that's important for me as well. Yeah.
Would you ever write a book?
Yes, I thought of writing a book in 2015. That's why I took up this job in Mugu. Actually, when I was working in Myanmar, I was working very closely with the government. Actually, we were working very closely with. There was this Lancet group, and they were from US. From Thailand, and I was representing from the University of Oslo. And while I was traveling all over, not all over, but different areas in Myanmar, I was thinking, what am I doing here? I could have done the same thing in Nepal, I should be in Nepal. What am I doing in Myanmar? So that was the kind of thought that struck me. And after coming back to Nepal, when I got this opportunity
when was this? What year was this, if I may interrupt you?
Between 2014 to 2016, I was working for University of Oslo. I was teaching PhD and master's student at Yangon University. I was supervising them, and yeah. So yeah, and then when I got an opportunity to work for Koika, it's a Korean agency here in Nepal. I said, I'm going to Mugu. I think initially a lot of people did not believe that I would go to Mugu and work in Mugu. Even my cousins were like, are you serious that you're going to Mugu? You might even forget how an elevator looks like once you come back from Mugu in 5 years. That is the kind of conversation we were having. And I left for Mugu, and then I was thinking that, okay, the first thing is I'm trying to, I'll work on this project, I'll do whatever has to be done in terms of building health system. But at the same time, I was trying to find some characters for the book. Because from my past experiences, what I've seen is the people living in Kathmandu are so, they are so disconnected from the lives of people living in different areas. So I thought that probably I should bring in those perspectives as well, because people generally in Kathmandu tend to think that if you have a PhD, if you have a doctorate, if you have a master's, that's what matters, and that those are the opinion makers. And I think that no, there are people who have lived experiences, and those are also very important, very important.
Absolutely.
To have, not just the degree. The degree means nothing. So that's why I wanted to find some characters in the book, and yeah, and that's why I took up that job for some time. Yeah. And I'm planning to write, but
so
yeah,
we can I was saying, so we can look forward to a book from you in the future.
In the future, I hope.
Yes.
I can accomplish writing a book in the future. Yes, I would definitely love to write a book. In fact, actually, I even thought of writing a book, and then when I was in California at my brother's place, I said that I want to write a book in 2015. And then he said there is a guy who had won the American something prize. So he said that I could introduce you to him, and then there was this earthquake, and then everything, the conversation went in a different direction. So, but yes, I would love to write a book someday.
Is there anything during this course of conversation that you felt like you wanted to share and we did not touch upon? You can talk about that now.
I don't have anything as such. I think I've shared whatever I thought was relevant, or whatever I felt like. Yeah.
So I guess I will have to conclude at that point. It's 6:11 now. Thank you for going beyond our time schedule. We really appreciate this conversation, you, our team, Shefali, Vishal, Shivani, and Pranav, and myself. It's been a really interesting conversation, and we have to tell you this. We're so impressed with all this work you're doing, even as a team. We've been talking about this, and you've been doing so much in terms of your writing, research, and also your community work and your activism. And we look forward to seeing more of what you have to do in the future. And we hope to talk to you again in the future. This has been an interesting conversation. Thank you for your time.
Yeah, thank you so much. Thank you. Thank you.